Hi, my name is Starr Strong, and I'm an HG survivor. I'm here to present to you what it's like to suffer from Hyperemesis Gravidarum from a patient's perspective. So when I was younger, I was in beauty pageants, I modeled, and I was loving life. In my 20s, I got in a horrific traffic accident, and it shattered my world. I was in the hospital for quite a few years. I was in a coma. I was paralyzed. I had to learn how to read, write, speak all over again. At that point, it was the hardest time in my life. And by the time 2009 came, I was finally being able to walk and exercise and not have to rely on my wheelchair 24/7. In 2010, I met my husband, Robert, and we fell in love. We got engaged and we were excited. It was awesome, to just be in love. And then all of a sudden, I started getting really sick. And I had a feeling I was pregnant. Now, I went 8.5 years with no period. I was told I would never be able to carry a child. I couldn't get pregnant. At one point in time, I was diagnosed with pelvic inflammatory disease and also polycystic ovary syndrome. I was given hormones to try to start my periods, and I could not have a period. So I had to come to terms that I was never going to be a mother and have any children. And I was okay with that, but deep down inside I was sad because I wanted to be a mom. From the moment of conception to the end of my pregnancy, I was very ill. It started with me getting constantly sick. The slightest things, the smell of food, somebody smoking, what somebody was eating, I was just getting deathly sick. I couldn't hold down any food, any fluids, nothing. My husband would take me to the ER and they would give me 2 bags of fluids. They would say I wasn't pregnant and send me home. So he'd wheel me out sick and I'd be crying. And then the next day I'd be back at the ER again, vomiting nonstop, unable to hold anything down. At one point, I took more than 15 pregnancy tests. They all kept coming up negative. And every time I went to the ER, the tests were negative as well. So they were telling me, you're not pregnant, there's no way you can be pregnant. And I just had this feeling inside because of how sick I was, that something obviously was going on with my body, and this was not normal. I was ending up at the ER, 4 or 5 times a week to get fluids, to get anti-nausea medication, to get pain medication, because my stomach hurt so bad. I was throwing up so much to the point of blood. My throat was burning. It felt like battery acid. I was screaming. They'd give me GI cocktails to try to numb the pain. By the time I was about 5.5 weeks, 6 weeks pregnant, I went to the ER. They did a blood test and they confirmed I was pregnant. They were worried it wasn't going to be a viable pregnancy because of my pre-existing health conditions with my auto accident, or that they thought it was possible it could be a molar pregnancy just because of how sick I was. So I was admitted into the hospital for, observation, testing. Little did I know this time I'd be admitted for 3 months. Every episode that I had from HG, would last for days, sometimes 24 to 48 hours. At one point in time, I vomited 98 hours straight, nonstop. I had 3 OBGYNs come in the room and tell me, Miss Andrews, we need to speak with you. You're not going to survive. Your sodium levels, your potassium levels are critical. If you do not have a therapeutic abortion, you are going to die. When somebody tells you if you don't do something, you're going to die, it's scary. I was terrified. By the time those 3 OBGYNs walked out of the room, I was convinced the only way out was abortion. And I know there's other moms out there that have felt the exact same way. I wasn't offered any alternate plan to help me, so I was convinced that I needed to have an abortion. And I'm so grateful I didn't, or I wouldn't have my beautiful little girl. So when I decided I didn't want to have an abortion, the OBGYNs were actually really upset at me. My husband came in and told him to stop treating me like a caged animal and treat my wife and my child. I thought at that point in time, when my husband was standing up for me, things were going to be good. But they weren't. I came across so many people in the hospital and in my life that just did not understand what Hyperemesis Gravidarum was. Now, the first time I heard the words hyperemesis, I honestly had no idea what it meant. I was like, hyper what? I had my husband go out and go Google it because I really didn't even know what it was. I knew whatever was going on with me was not morning sickness. It was beyond. So he went outside because the hospital didn't have service at the time, and Google did. Came back in, and I was able to read a little bit about it. I was like, this is what I have. But the problem was I didn't have any understanding doctors that understood what I was going through. I didn't have compassionate nurses that got it. I didn't even have family and friends that got it. I only had a small inner circle of people that believed me. Never seen anybody go through what I was going through, but at least they believed me. I mean, that's really what got me through, because I had no validation from the medical community. I kept getting IV fluids. At one time I had 2 IVs going, medication. They couldn't get me to stop vomiting. You know, I was told it would go away, 11 weeks. After 11 weeks, it didn't go away. I just was still constantly sick. By the time I was discharged in October, I was able to make it to my wedding, barely. And by the time we came back, I ended up back in the hospital again. I was still just being told I had morning sickness. I needed to suck it up. I had nurses would take my bucket away from me or withhold my medication because I was told that I was throwing up because I didn't want my baby. I was told my husband was pressuring me into keeping a child that I didn't want. I was told it was psychosomatic and it was all in my head. I had doctors and nurses telling my husband and my family that I was doing this to myself because I wanted attention. I was pretty much bedridden when I was home because I was constantly nonstop vomiting. No matter what I ate, drank, always came back up. But I always would try to keep something down because it helped so I wasn't vomiting blood and acid. When you're vomiting that much and you're vomiting blood, it's terrifying. It's just terrifying. I just wish somebody would have took me seriously and validated and believed what was going on with me. And that was just really, really hard to deal with, not having understanding. I would have OBGYNs twist my words I even had one OBGYN tell me I needed to see a shrink for my eating disorder. And because I wouldn't see a shrink for my so-called eating disorder, I was told I was an unfit mother. Now, being a first-time mom, that was devastating to be told I was an unfit mother. I was suffering from this rare condition, hyperemesis, yet I didn't have any understanding, and because I wouldn't see a shrink, I was told I was an unfit mother. I was told I was making this all up, it was all in my head, having little support from family and friends and people saying, oh, it's just morning sickness, it'll go away. Try not to think about it. Well, it's hard to not think about it when you're constantly throwing up and you can't hold down anything. And I think that's where the understanding of most people don't get. There's morning sickness and then there's Hyperemesis Gravidarum. They're not even in the same category, in the same ballpark. It's not acute morning sickness. It's not severe morning sickness. It is Hyperemesis Gravidarum. And most people just don't understand the difference. I mean, there's things with HG that you don't get with morning sickness. Morning sickness, you're able to function, you lose little weight. With HG, you can't function. I was bedridden. I wasn't able to do the normal things I wanted to do or leave my home because nobody understood what I was going through. It was just so hard not having understanding. And I feel that the medical community could just understand what it's like from the sufferer's point of view. I mean, every little thing in my life affected my daily life. From somebody cooking, somebody eating something in front of me, for any type of smell would trigger me to vomit. Watching food on the TV, like if somebody's watching the Food Network, would make me deathly sick. When I was in the hospital and it was time for breakfast, lunch, or dinner, anytime the food would go around the hospital, I could smell it, even with my door shut. At home, I would have to block sheets underneath the door and put my head in the pillow. I didn't want to go out because I never knew when I was going to get sick. And I was just confined mostly to my room. And it's so hard to not have understanding, not just only from the medical community, but society in general. Most people just assume it's morning sickness when it's not. By the time I was 5 months pregnant, I was finally able to get an IV PICC line. And only because the doctors were sick of seeing me in L&D, because no nurse can get an IV in me. An anesthesiologist would have to be called and have to come in. They would be very angry and pissed off at the nurses because they didn't understand why these nurses couldn't do their job. Then the anesthesiologist would come in, try to poke me, not get it in. He'd be like, "Oh, you're dehydrated." Well, yeah, I'm dehydrated. I need fluids. Please help me. They tried to put IVs in my feet. I would have to get them in the back of my wrist, and my IVs would always blow. So an IV would never stay in very long. They would start to give me fluids. It would blow. All I wanted was fluids and medication. I just wanted it to stop. I remember I was in L&D one time and the nurses were trying to wake me. Knocked out, and at that point in time, I didn't know it, but I was depleted on thiamine. I was completely out of it, and at that time, I didn't know my life was on the line. Even when I finally did get my PICC line and was on home health care, I was still at the hospital 4 or 5 times a week. And that was mostly because I didn't have a nurse that constantly came to my home. My husband became my nurse. My husband had to change my IV bags. My husband had to put my vitamins in my IV bags. So I had to get it through my OBGYN. And I would only get about 15 vials of Zofran. Now you have to think, one vial, actually 2 vials, I would have at a time to equal the amount of medication I needed. And that would be every 8 hours. So every few days I would run out. The pharmacy wouldn't have it in stock. I'd end up back at the hospital. The lack of understanding, the lack of doctors not getting what you're going through and validating what you're going through, it's hard. Every time I ended up in the ER, I needed my other medications, but I couldn't hold my medications down. They didn't want to give them to me by IV. They tried to feed me pills, and I'd throw them up. And then they'd get angry at me, and my husband would have to get an administrator involved to override what the ER doctors or the L&D doctors would do. So the last 3 months of my pregnancy were still hell. I was still getting treated as though I shouldn't be suffering from Hyperemesis Gravidarum. Now, some moms, it does get better after 20 weeks, and then there is a percentage of moms that it doesn't, and I was one of those moms. So I was being told that I shouldn't still be sick. I was at the hospital almost 4 times a week, and I was having contractions every single day, even 1 to 2 minutes apart. I couldn't wait to have my daughter. And my OBGYN said the soonest I can have her and the safest would be 39 weeks. Now, I had to have a C-section. I couldn't have a child naturally due to my auto accident. They were unable to get an epidural in me, but they were able to get a spinal. Now, it wasn't easy because the day of my C-section, actually the day before my C-section, I was even in the hospital in L&D. And I had preeclampsia, had protein in the urine, and they didn't want to deliver that day. They said I could just come back in the morning and have my scheduled cesarean. So when we get there, you know, the time kept being pushed back and delayed and delayed. So before having my daughter, I had to have like a bag of steroids, I had to have fluids, and they take me into the OR. I tell my husband to wait outside with my family and that he could come in shortly. Well, I ended up being in there for over 3.5 hours because they couldn't get an epidural in me, and they had serious trouble getting the spinal in me because of my back. So they thought they were going to have to put me under general anesthesia, and I was a bit terrified because they were telling me that, you know, oh, there's going to be all this risk to my daughter. And I was already told my daughter was going to be in the NICU for the first 3 months of her life. Don't get attached to her. Don't bond. Don't expect to go home with your daughter. Finally, after they got the spinal in my back, after 3.5 hours, then my husband was able to come into the OR. And everything kind of, at that point, went pretty quick until it got to the point that they cut me open. And from all the vomiting, my daughter was stuck up under my ribs. So there was a lot of pulling and tugging, and they couldn't get her out. I remember hearing my OBGYN and the other OBGYN that was there on call helping her, saying, I don't know if we're going to be able to get this baby out. And I was just praying that whole time, Lord, just let her cry. Just let her cry. And it seemed like forever before I heard my daughter cry. They finally pulled her out, and you know, I was waiting for that cry that took forever, and then finally I heard her cry, and it was just a moment I would never forget. And then I was thinking, oh my gosh, the HG is going to be over. Thank you, God. I did it. I beat HG. And then my husband went over there where my daughter was, where they cleaned her up. I kept telling him to get a photo of her. I just wanted to see what she looked like, because I couldn't see what was going on because there was a curtain in front of me. So I didn't know how she was doing. They ended up handing her to my husband. She got to be in his arms for a few minutes by me. Now my arms were strapped to my sides, so I couldn't even hold her. I just wanted to see what she looked like more than anything. And then they said they were going to take her to the NICU for observation. So he went with her. My stepdaughter and my husband were in the NICU with Kiara. She was actually doing okay. You know, her glucose was a little low, but she wasn't suffering from all these things that I was told that would be wrong with my daughter. She only had to stay in there for 2 hours, and then she was released to my room, praise the Lord. When my husband wheeled up with her, I thought that they were just letting her visit me. I honestly did not think I was going to be able to have my daughter in my room. My husband came up with her, and I was like, they let her visit? He's like, no, they released her from the NICU. And I just remember crying, praising, and thanking God, like, oh my gosh, this journey is over. My daughter's here. But then, you know, the first time I held my daughter, I was so happy, thinking, wow, I went through hell to have her. I survived. But then I was left with all these thoughts of, why did I go through hyperemesis? Why did I not get help? Why didn't I get better care? Who's going to help me with processing all these feelings that I was I had anger, I had resentment towards the medical community. I was released 3 days later, and my daughter got to go home with me. She was so tiny. She had no meat on her whatsoever from me being so malnourished. My daughter was malnourished. No baby fat on her whatsoever. She was born at 6 pounds, 10 ounces. Now, when I had my last scan, they told me she was in the 10 percentile, that she was going to be really small. So I was expecting my daughter to be 4 pounds. So I was ecstatic that she was even 6 pounds. We brought her home, and from that moment on, I was happy to have my daughter with me, but then the whole aftermath began. And my daughter just had issues from day one, not being able to sleep, having reflux so bad she was vomiting like the Exorcist, all her formula. And slowly but surely, I was seeing all these issues my daughter was having. I had 2 friends at the time that had babies the same time as me. Now, they didn't suffer from HG. And when I would hang out with them, I noticed my daughter was different. My daughter was doing things that their children didn't, and they would look at me like, what is wrong with your kid? And it scared me, because I'm like, why is my daughter different? Why is my daughter screaming and arching her back when I'm giving her a bottle and their kid's fine? Why is my daughter puking all her formula and their kids aren't? It wasn't until I actually met another HG mom, probably a year after my pregnancy, and I was telling her everything I went through, and then she validated everything I was saying and said her child had the same issues as me. And when I met her, that's when I knew, you know what, I need to advocate for moms that suffer. I made myself a promise that if I survived HG and me and my daughter made it, that I would help any mom possible, that I would advocate, and that I would help raise awareness for what having an HMO, I feel, directly made a huge impact of why I had horrible medical care. Perhaps maybe if I had better medical care, I could have had the other options that were out there to help me during my pregnancy, so I wouldn't be suffering in the aftermath. For many moms like myself, having Hyperemesis Gravidarum, HG isn't over once you have your baby. And there's so many treatments out there now, and they were out there then, but I wasn't able to get them. I was denied to have TPN at home. Go through your IV PICC line and be able to give me nutrition. It's so important when you're pregnant and you're starving. You need to have better care. More aggressive care, I think, is necessary. You know, from having not just a PICC line, get a feeding tube into your stomach, into your intestines, and you can have a Zofran pump, a Reglan pump. There's just so many other treatments that are out there that I wasn't given. I mean, honestly, I was tortured by my HMO. The last 3 months of my pregnancy, I was having contractions every single day because of the stress and not getting good care. It's been 5 years since the birth of my daughter, and I'm still suffering in the aftermath of Hyperemesis Gravidarum. And I feel if I had better care, my daughter and myself wouldn't be suffering now. There's so many moms out there like myself that are scared to talk about once they have their baby. They're still suffering, but they're too scared to speak up, because the medical community feels, okay, you suffer from hyperemesis for 9 months, you're pregnant and starving for 9 months, and then you have your baby, you're handed this baby, and then you have to deal with, what the heck did I just go through for 9 months? I literally just survived this hell, and I'm handed this child. What do I do now? And people and doctors and nurses and even family and society, expect for you to be better. But these moms, they suffer from postpartum depression, post-traumatic stress disorder from pregnancy. They suffer from CVS, which stands for cyclic vomiting syndrome, which is very similar to hyperemesis gravidarum, but you're not pregnant. Moms get gastroparesis, which is slow emptying of your stomach. This is one thing that I suffer from as well. I mean, the list just goes on. Depression, you feel isolated because you're alone. Many of the children that are born to hyperemesis gravidarum moms suffer in the aftermath as well. My daughter is one of them. Many of these children have neurological issues, have sleep issues. Almost all of them get reflux, have allergies, food allergies. I can tell you that every mom that I know that has suffered from hyperemesis has post-traumatic stress. Mom's mental and emotional welfare needs to be taken care of during and after HG. It's so important to have that addressed during and after pregnancy. I'm able to help other moms have a better outcome, and that's what has helped me survive these 5 years, that being able to help other moms not have to just go through and suffer the way that I suffered. If you had morning sickness, yeah, C-bands and crackers and ginger ale and all that stuff would help. You can't cracker an HG mom. You can't tell an HG mom to suck it up. You can't tell her to forget about it. And this is where education and research and just basically getting the word out that there is this rare pregnancy condition called hyperemesis gravidarum, and mothers are suffering from it. It's life-threatening. 1 out of 3 babies don't make it to a live birth. And I believe that number is much higher because of how many moms I see lose their babies every day. I'm in a lot of support groups where I advocate and where I give support to moms, and every day I at least see 7, 8, 9 moms lose their babies. It's devastating. Moms are forced into an abortion because they feel it's the only way out, because the doctors aren't giving them a choice of aggressive medical care, stillbirth. Many babies are born sleeping because of not getting good medical care with hyperemesis gravidarum. If more doctors, more midwives, more OBGYNs, the ER and L&D just had a better understanding of hyperemesis gravidarum, I think it would make a world of difference. A world of difference. And I hope that this video will make a difference with somebody sitting in this room. You know, it just takes one doctor to make a difference, even if it's only with one patient. I hope that you will learn from this video to realize to treat a mom with HG seriously. Women have died from hyperemesis. Babies die every day from hyperemesis. Moms are forever changed by hyperemesis because of not good medical care. It's not fair to be suffering in the aftermath after I went through 9 months of hell to have my daughter, and I'm 5 years later and I'm still suffering. Many moms, HG determines the size of their family. Many moms don't want to do it again because they're sick. Or many moms think that they won't get HG again. And unfortunately, most moms, when they get HG the second time or the third time, it's worse. And I just hope that this video makes a difference. I hope that you will learn what HG is and take an HG mom seriously and just know that early intervention is the key. I say determination, not termination, because termination is not the answer for hyperemesis gravidarum. Aggressive medical care for the mother and the baby and their well-being is what should be number one. Thank you for watching this video, and I hope that you have learned a little bit about what it's like to suffer from hyperemesis gravidarum from the patient's perspective. My name is Starr Strong, and I am a health advocate for hyperemesis gravidarum and CVS. Thank you.
If you're needing support and you're suffering from HG or in the aftermath or need more information, please don't hesitate to reach out to me. 909-261-1111. Thank you.